Have you considered that with only Original Medicare benefits as your coverage, you would be responsible for paying 20% of all of your outpatient services, or that you would have deductibles and copays to pay for hospital stays and skilled nursing? Hi there, if we haven't met yet, I'm Danielle Roberts, co-founder here at Boomer Benefits, where we help baby boomers learn how their Original Medicare benefits work, and then we help them select suitable supplemental benefits that match their personal needs and budget. In this video, I'll explain what sorts of costs you might expect to pay if you only have Original Medicare benefits so that you can determine whether you need a Medigap plan. I'll also explain how Medigap plans work to fill in the gaps in your Original Medicare coverage. Stay tuned until the end for an invitation to our next New to Medicare webinar, where you can learn all the basics you need to know in a hassle-free environment. If you think about health insurance coverage that you've had in the past, you probably remember that it didn't cover 100% of all of your expenses. Most plans here in America have deductibles that you pay first if you go into the hospital, and copays that you'll need to pay when you visit a doctor or fill a prescription. Medicare works exactly the same way. It has deductibles, copays, and coinsurance that you will owe whenever you use your Medicare Part A hospital benefits or your Part B outpatient benefits. The deductibles aren't small either. You'll currently shell out over $1,300 in deductibles if you spend even one night in the hospital. And if you need to recover in a skilled nursing facility, Medicare pays for the first 20 days, but then you begin paying more than $170 a day thereafter. These costs are daunting enough on their own. However, that's not all. Your Medicare Part B benefits only pay for 80% of your outpatient expenses. Now, if you're fairly healthy, you might think to yourself that you don't mind paying 20% of the cost of a doctor's visit when you only see the doctor maybe once or twice a year. But Part B also covers things like diagnostic imaging, which includes CT scans and MRIs and PET scans. It covers ambulance rides and outpatient surgeries, chemo, radiation, and dialysis. I think we can all imagine that paying 20% of those items would add up pretty quickly. So this is why, of course, Medigap plans were created back in the 60s. These policies pick up where Medicare leaves off so that you don't have to worry about what kind of bills are going to show up in your mailbox when you get home from a 3-week hospital stay or a long stint in a skilled nursing facility after a surgery or a stroke. The reality is that even if we are totally healthy today, we never know what tomorrow will bring. If Medicare will be your primary coverage and you don't have any employer group health insurance or retiree medical benefits that will help you to cover your share of the costs, you will want to consider some additional coverage to fill in the gaps. Medicare beneficiaries can choose between Medigap plans and Medicare Advantage plans to help them meet the gaps. Here on YouTube, we have another video about the pros and cons of Medicare Advantage plans. So in this video, let's discuss Medigap plans, which are also referred to as Medicare supplements. If you want the freedom of access to your favorite doctors and hospitals, you may like a Medigap plan. People with Medigap plans can see any Medicare provider in the nation. This gives you access to over 800,000 providers to choose from, and it doesn't matter which insurance company you buy your Medigap policy from. Your policy will pay on any claim that Medicare approves, regardless of whether you chose that policy from ABC company or XYZ company. It also makes Medigap policies great for travel. You can see doctors in Florida or Washington or anywhere in between. Some Medigap policies also come with up to $50,000 of emergency foreign travel benefits as well. Another feature that many people enjoy about Medigap plans is that you don't have to get a referral from a primary care doctor when you need to see a specialist. Medigap policies don't have networks, and so they don't require you to designate a primary care doctor. If you wake up tomorrow with a blemish and you want to go and see a dermatologist that accepts Medicare, you can simply book your appointment and go. Lastly, if you have pre-existing conditions, you might also enjoy how Medigap plans have very predictable back-end costs. For example, a Medigap Plan G will cover all of your approved doctor appointments for the year after you have first met your small annual Part B deductible. This means that even if a health condition is causing you many doctor visits, you don't have to worry about breaking the bank because there are no doctor copays that you will owe. What you are buying when you purchase a Medigap policy is peace of mind. Medicare also gives everyone a one-time 6-month Medigap open enrollment window. This means you'll have a chance to sign up for any Medigap policy you want when you first activate your Part B, regardless of health conditions that may exist. Be sure to check out our video here on YouTube about your Medigap open enrollment period and how that works. Here at Boomer Benefits, our team helps new Medicare beneficiaries apply during the proper election period so that they don't miss this window. And then on the back end, we also provide support and assistance with any Medicare problems, issues, claims, denials, or questions that they have for the rest of the policy so that they're never alone in dealing with Medicare. So if you've been asking yourself, do I need a Medigap plan? I hope this video has helped you to see what kinds of costs that a Medigap plan would help you to pay. You can visit the Boomer Benefits website today to read more on how both Medigap plans and Medicare Advantage plans work so that you can decide which style of coverage feels right to you. After you do, please be sure to comment below and let us know which type of coverage you like the best. You can also sign up for our next free New to Medicare webinar. I'll put the link in the notes below this video. And finally, if you would like to be notified immediately whenever we release a new video here on YouTube, be sure to subscribe to our channel today. Thanks for watching, and we'll see you in the next video.